it this way. Together we play. We are IMA. From the beginning till the end of this day, we move and we sway. Together we stay. We'll take your hand and help you through the mistakes. Whatever it takes, we'll find a brand new place. We'll join our hand in hands and then we'll fly till the end of the time, till our worries will die. We'll do it our way, the IMA way. IMA. It's a dream to be at our best. We fight on our own with no room for rest. It's a dream to be at our best. We fight on our own with no room for rest. And it's a legacy that we want to leave. Make them all believe there will be no grave. Turning white from the black, just like raising the flag. We'll do it our way, the IMA way.
I have seen IMA growing as a small city organization to a nationally recognized association.
As Team IMA, I'm dealing with a commemorative issue.
Indore Manager is a 20-year-old IMA publication. It carries articles.
As the theme says, work the talk, leadership now. I guess this time also we lived up to the benchmarks that we set for ourselves at IMA.
Now I'm a part of the team which manages the students. But I personally feel that joining IMA and those who join IMA as students or at any level get is excellent man management skills.
IMA for me is a pool of opportunities.
It's a live experience.
IMA has done a unique thing this year. It's picked up a very important concept which is so close to the minds and hearts of people, called the Nukkar Natak concept.
Is the animation going on in the Conclave. And that animation is not prepared by any professional organization. It's prepared by the students of Indore.
IMA is so different because we are developing the professionalism at IMA. We are trying to doing our own things at own, because we are not hiring the outsource agencies to do our programs and create an event.
We not only get world-class speakers in terms of Mr. Amitabh Bachchan or Mr. Ramcharan.
We are trying to create world-class ambience and facilities at the venue this year.
So it's a big challenge for us to up the ante this year. I'm sure we are going to do better than what we have done over the last years.
There has to be a reason why people like Dr. Ram Charan, Dr. Narayan Murthy, they all have associated with IMA.
It provides a fantastic learning and networking opportunities for local businesses, which is unmatched and unparalleled.
IMS International Conclave is the most awaited event for the students, academicians and industries.
IMA is all about Yariya. It's all about management ki Ras Leela, and it's all about creating dhoom each year in the form of events at the rate of perfection.
एक बरस में एक बार ही जलती होली की ज्वाला और एक बार ही लगती बाजी जलते दीपों की माला। दुनिया वालों किंतु किसी दिन मदिरालय में देखो कि दिन को होली रात दिवाली रोज मनाती मधुशाला।
To all the people in IMA, it would be incomplete if we do not say a big thank you. Starting with the students who come with all the vigor, the faculties who send the students and who come across to the EC members of IMA, to the sponsors and to various education institutes. A big thank you, and we see you next year.
Dr. Preetha Reddy is the Managing Director of Apollo Hospitals Enterprise Limited. In 2009, the Honorable Prime Minister of India, Dr. Manmohan Singh, invited her to join the Indo-US and Indo-Malaysia CEOs Forum. Think tanks created to strengthen bilateral cooperation and trade. Dr. Preetha Reddy was ranked in the international list of 50 most powerful women in business by Fortune in 2010 and 2011, and also in the most powerful women in business list compiled by Fortune India 2011. She is also closely associated with Sachi, Save a Child's Heart initiative. Ladies and gentlemen, please put your hands together for the woman of substance, Dr. Preetha Reddy.
I represent All India Management Association here today, and who's had a great relationship with the Indore Management Association. And I'd like to thank you all for the invitation, for the warm welcome, starting from we landed at the airport to the fact that, you know, there's been a very charming girl who's always asking me, is there anything I can do? I think the care has been tremendous and the organizing has been fantastic. Thank you all so much for that. I'd like to congratulate Mr. Shamit Dave and Mr. Amit Bidasaria, the Conclave chairman, the president. Shamit is the president of IMA. Both of you, I think, have put together a phenomenal job. Conferences to me don't just mean a lot of effort and a 2-day session where everyone hears great speakers, forgets maybe 70% of what they said, remembers 30% and walks away. I think management associations are the ones who really make a change in our country. They are the ones who inspire a lot of youngsters who I see in the galleries to really make India what it is. I, for one, am very proud to be an Indian, and I know that all of you live in very challenging times. So sometimes when I hear this murmur, and it happens at home with my children about what a terrible place India is to live in and what a mess the whole country is, please remember that the housekeeping begins at home. And all of us have to learn to be better managers, deal with challenges better, literally work the talk better. And I think the topic was phenomenal, and my congrats go to whoever picked the topic. Because, I was looking at it, I just had time after I landed to really go through everything and figure out, what I should be saying. And I thought, my God, people talk about walking the talk. And then you visualize it, and then you see this great CEO who can actually walk the talk every day and not work the talk. So I think whoever picked the topic, we need to give them a big hand for that first. And in these days of, a lot of talk, because wherever you go, you see talk, you turn on the television, there's huge talk. If there's a topic, then immediately any one of the channels, they put together the thought leaders who really presume that, they are the answer and prescription for India, and then they're talking, and you switch every channel, whichever of the big channels, and then these panels discussing what has happened. So there's 6 people who are really, getting into your brain and into your system and telling you you have to think like that. I'm not against, media or television, but I really think that they control our intellect way too much. So when I was asked to speak immediately after Mr. Ram Charan, I said, my God, that is probably one of the biggest challenges in my life. How does one who's just running hospitals come and speak after a thought leader, a thinker, a trainer, a teacher, a Dronacharya, the way he was called, and give my little 2-bit of wisdom? Huge challenge. So what I did while sitting there and listening to him is, I did have a bit of a prepared speech, and I said, oh my God, I better not do it because it will really be like a small drop of water in a mighty ocean. So I've forgotten that. I'm not going to do that. But what I'm going to maybe try and give you my 2 little bit of his very inspiring lecture, and what our stories about working the talk and dealing with challenges, because that was the topic for today. So very interestingly, he said, who are the 5 leaders who you think have impacted, and will you please share that with your colleague? So we had these names, and we had definitely we had Bill Gates, and we had Sunil Bharti Mittal, who came up in his. But then I said, will you please forgive me? But I want to say that my father's the one who's, who's impacted my life and who's made it change in our business. So if I give you a story about, literally what the Apollo story is, and you will see that some of it really went ahead and spoke about these 5 points which the great Mr. Ramcharan spoke about. And he's truly a guru, and so I was looking at this analogy while I was sitting and speaking to him, and I said, okay, fine, maybe I'll just go back and tell you the Apollo story and see if that answers a lot of the challenges. So we started in 1983 because Dr. Reddy, he came back because his father, we're agriculturists by family, we belong to a small village in Andhra Pradesh. My grandfather had rice and sugarcane farms. My father was the first person who left the village and became a doctor because apparently one day his mother was so frightened of an injection, she said, you know, Pratap, if you were a doctor, I might have taken the injection. So my father left the village and decided to become a doctor simply because he thought his mother would be happy. And he became a doctor and then left and went off to the US because most doctors at that time felt that India wasn't the greatest place to practice. If you wanted to do something, you know, great, phenomenal, make a change. So he lived there for about 7 years. We grew up for a short while in the US. And then there was a letter from his father who, you know, because my dad would write letters to him and say, you know, I'm doing this, I'm presenting papers, we've done this, etc., etc. And he said, the letter said in Telugu, you know, why does it matter what you do in the US? If you do something for your country, then you'll truly be my son. And this was in 1970. My father immediately packed up his children, his bag, sold whatever he had, sold his car, and bought the first ECG machine which came into India. So that was really how it started. But in 1983, there was a patient, and we all remember him because, you know, as children on holidays, we were told, go and help, let's go help, you know, your father, don't sit at home because there's nothing for you all to do. So even as kids on holidays, we started going to his little clinic to help him. So this patient died because he could not go to the US in time for a cardiac surgery. And that got him thinking. He said, you know, if this man cannot do it, how many more Indians are dying because there is no proper health care? So that was like the first challenge. And to all of us, you know, my father reads Sundara Kandam, the story of Hanuman and how he crossed the ocean. And Hanuman did it. He didn't think he could do it. Till Jambavan the bear told him, Hanuman, it's in you to be able to cross the ocean, to leap across. And he found that strength and he did it. So my father always said that belief is power, and he believed he could do that. And I think that's probably the first biggest management lesson, that you should believe you can make a change. So this is how it started. And I'm not saying it was easy because we didn't have the money. You know, it was a small premise. We used to share even the secretary's salary was a big challenge those days. So anyway, to build a big hospital needed finances. So then he went to the government of India and said, I need two things. I need to be able to allow the banks to fund government because those days it did not happen. So a lot of trips back and forth, staying in Delhi in small guest houses, but it happened. And the second thing is, can a hospital be listed in the stock exchange for us to raise money? I mean, he got phenomenal help because we didn't know ABC or finance. But you know, there were wonderful people in Bombay, including the ex-RBI governor, Bhupan Dalal, who helped. So we got listed, first hospital company to be listed in this part of the world. And it happened. But I'm saying all this because, you know, if you have a sense of purpose, a sense of focus, somehow you're able to overcome the challenge. So we did the first hospital in Chennai. Today, okay, fine, you know, we're in 60 locations, 10,000 beds, adding 5,000 beds. To me, now it's become statistics and data. And I'm telling you that because, you know, the top line of an organization must be there because you have a shareholder's responsibility. You have to meet your targets in EBITDA, otherwise you're not a great CEO. But the single thing which makes you a fantastic CEO is the fact that you have passion. You know, you don't swerve from your sense of focus. And for us, the sense of focus is the people who trust us and who come to any Apollo hospital anywhere in the country. And we try. I will never ever say in healthcare that we get it right all the time. It's not possible to overcome the way a human body functions, but you have to sincerely try. And I think that is what, so you have to get the right people in place. You have to talk to them the right way and tell them that whatever happens, you know, you have to see that whoever comes to our doors gets the best possible treatment, which you can do. You know, you should get the best technology, you should build the best places. But I also learned this, and my father would constantly tell us this, that today, you know, in this century, the banks are after us to fund. Private equity is just dumping tons and tons of money into healthcare. So there's money in the country to build hospitals. But what is not there is the people, is the manpower, is the talent. And it's they who make a difference. And it is the people who make a difference wherever we go, in whichever sphere of activity. And that is why I think that, management associations have to go back and reinvent themselves sometimes and allow people to have the pride and the belief that they are actually the power. They're the ones who make a difference. We love technology. I mean, we cannot exist without our iPads and our iPhones and our telephones. But the moment you let technology overcome you, and I'm talking about this from a completely hospital perspective, and you forget the me in it, and it becomes an it, you really forget what you're doing. You're not able to contribute. And this again is clarity of focus, and that was one of the management lessons which we learned a little while ago. And I think that's really what kept us going. There were many challenges, and the challenges continue to be there. The first challenge was the geographical challenge. People can come from, and it exists, it still exists, people can come from all parts of the country to one great hospital located in the metros. But India is not about the metros. India is not about Bombay, Delhi, Calcutta, Hyderabad, Bangalore, and Chennai. And I looked at Indore, and it's definitely a metro. So I'm trying to say is that, the geographical challenge is phenomenal. And we have to then become innovative. We have to find ways and means to do it. And that is where I think technology has played a huge part. We were the first ones who brought in this whole concept of telemedicine. Exciting, we had Bill Clinton open it for us. But today, ladies and gentlemen, with all the institutions, whether it's Apollo, Fortis, Narayan Hridayalaya, AIMS, so many healthcare institutions coming together to provide, using technology to provide, consultation and telemedicine services. We're the world's largest telemedicine provider globally. We provide the largest number of telemedicine services for the African nations, for Bangladesh, for Indonesia, for remote locations in Malaysia. And collectively, I think the power of Indian healthcare, the way the Indian healthcare providers are going, they're really going to be able to take on a large part of healthcare, of the healthcare burden globally. But having said that, there's another interesting thing which has happened, is that we are able to provide teleradiology services in India. And again, India has become one of the largest providers of teleradiology services, simply because other countries don't have the kind of manpower which we still seem to have. So from just being a hospital provider, from just being able to do high-end, good quality healthcare interventions, we have changed the healthcare landscape. And when I say we, please understand, I'm not talking about Apollo, I'm talking about the industry. The healthcare industry in India has changed the landscape so much that we're doing remote services for other institutions, including Johns Hopkins in the USA. So, that's the kind of level we've gone to. We participate in very high-end research programs. We train doctors, nurses, paramedics for the African regions, for Indonesia, even for China sometimes. So that again is what Indian healthcare is doing. We have patients now coming from 103 different countries to hospitals in India looking for healthcare. So I think that truly to me is what belief and power is all about. That in 1983, we just did one hospital somewhere in the corner of Chennai. But what has happened is that the whole healthcare landscape in the country has changed. There are many entrepreneurs now, there are many Dr. Reddys, there are many who are even better than Dr. Reddy. But the fact remains is that the whole industry has changed. And today, India has been looked at by the rest of the world as a country who can really give high-class, high-quality healthcare. Having said that, I think one of the most exciting rewards of this journey was that we as a team were asked to go into a US hospital, because all of you understand, have read, that Obamacare is something which is, causing so much of angst, or not all over the United States, but for all those who've even invested in the United States. So we've been asked to say that how can we give accountable, affordable, and accessible healthcare, because these 3 A's are the biggest challenge in the US now, and see if we can make a difference. So, look at a doctor coming back from the US and Indian healthcare companies being now asked to go back to the US to advise them on the basic principles of how they deliver on a healthcare. So I think this is the way our country is evolving. This is the way India is evolving. India will be a superpower in many areas of activity. But I think that all of us have to work together. Sometimes we just are not able to go forward simply because of the politics of running one of the world's largest democracies. But I think if the youngsters of the nation, if the young India rises up and says that I will not be influenced by 100 opinions, I will not lose my sense of focus, I will contribute in whichever way, in whatever way I want to do, and I will be there to make a difference, because I believe that belief is power. I strongly believe that belief is power. I think it's a job well done for all of us. For those of us who've learned and come to this level, I think, the journey is just begun, because there's just so much more to do. But for those of you who are beginning your journey, I'm just hoping that your journey will be so exciting and that you will forget all the problems and they just get, waylaid on the roadside, and you will look at the woods for the trees and you will overcome whichever challenges, because to me that is what working the talk is all about. That you literally have to work it and not worry about the talk which happens in hundreds of locations. And really speaking, after coming here and seeing all of you and interacting with all of you, I'm sure you'll do it. God bless. And I know that the youngsters seated here have a fantastic future ahead. Thanks for the invitation.
So we have a few questions for both the speakers, and I will just take a few of them and give them a chance to answer these questions. The first question is for Ms. Preetha Reddy. This is, I think, a very relevant question for many of us. How do you balance being a managing director and a mother?
I think I've been asked this many times. I asked my children of late, they've grown up and ready to get married. And I said, would you have liked things differently? Should I have been at home? And they said, oh God, you would have been a pain if you had been at home all the time. So I'm saying this because I think all of us as mothers, our primary responsibility when the children need us have to be with them. There's no going away from it. Because if you're not a great mother and you haven't brought up your children, given it your best, then the country's lost a great, citizen, and you've lost the option of bringing up a good human being. So I think God has given mothers a responsibility of bringing up their children. We jolly well do it right. So I think there's no question about it. It is a priority. They have to be given. But having said that, I think in 24 hours, if there's a sense of balance, you can actually look after your family very well. You can look after your children and do well at work. There's a whole process. You have to just put systems in place, even in the house, like you do in the office. And it's not great rocket science or to be able to really manage. You just have to have the power of conviction and have the sense of balance and willpower to be able to do it, and I think we'll just do it right. But now that you gave me the option, I have to just share one piece for all the women in the audience. This Bharat Ki Nari feels that she should make big sacrifices. I don't know if it's because of soap, because of all these TV channels, but women seem to think that they should just sacrifice themselves, their time, their energy, their effort for somebody else, whether it's the parents or the in-laws, the children, office, whatever. But please remember that your health is very important. And Indian women do not look after their health. We're the biggest country where women-related cancers is on the rise. Women do have heart attacks. Diabetes is very high among women. And this is all because Indian women don't think they have to look after themselves. Whenever I get a chance, I'm not myself if I don't tell others, please look after your health. Because I know I run hospitals, but I do not want you in the hospitals. You know, the biggest service I can do is to keep people out of the hospitals. And especially women, just wake up and don't be so sacrificing. The archetype, stereotype movie lady is really, the heroine is not you if you don't look after yourself. So please do that. Thank you.
In a field like healthcare, I think it's inevitable that many questions come about conflicts between making money and providing good healthcare. So I'm just going to take one question on that theme, which is kind of representative of the other questions. This question is from S.K. Mishra. As the leader of a chain of hospitals in India, how do you reconcile the objective of providing affordable healthcare to the masses with the corporate objective of higher profits year on year?
I think, I can take like 2 days to answer this question, but I'm going to do it really quickly and say what's relevant. Profit is just incidental. When you're handling healthcare, the outcome of somebody getting well is the most important. If you have to invest in high-end technology, you jolly well do it. If you have to do a certain process and not reuse material just because you have to make it cost effective, please don't reuse materials. You have to provide the best possible care, because when somebody is on an operation theater table, he's really not a VIP. It's the same man from whichever strata of society he belongs to. So he has to get the best. The best comes at a certain cost, but it's our responsibility to keep that cost as low and as marginless as possible. So I think any healthcare institution will have to provide, there is a certain cost. In the Indian context, it's very high because even now 80% is imported and the dollar does impact what the inputs into healthcare are. So it is expensive, but as an answer to it, I think we worked very hard to bring insurance in. Some of the states, like the states of Tamil Nadu, Andhra Pradesh, Karnataka, now we're working with Rajasthan. They are bringing in what is called like a chief minister's scheme. It's also backed by an insurance scheme for the average, the people literally at the bottom end of the pyramid. And I think that if this insurance, this health insurance grows and becomes, more and more active, is strengthened and the government really pushes it, every man can afford healthcare. And one quick example, I was in a little village in Tamil Nadu and they have this, the self-financing scheme where people really pay like 1 rupee a day for healthcare and for them to, do like small businesses. But that lady came to me and said, if anyone in my family gets sick, I can come to one of your hospitals because my whole family is insured for 80,000 rupees and whatever happens, I can take care of them. So I think if a lady in rural India, in a village who's, in these self-funding schemes can be so bold and be able to do it, I don't see why the rest of India can. It's just that we have to be innovative and there's no going away from the fact that providing high quality healthcare is expensive. I think profit is incidental and a lot of profit which comes from healthcare goes back into building those institutions. We used to own 2% of Apollo, one hospital. There's 60 hospitals and they're doing other things. It came from profit and it went back into it. And I think many healthcare players are going to have to do it that way.
So I have one last question for Ms. Preetha Reddy. When will all government hospitals become like Apollo? What is your advice to the government as well as the people of India?
I think all government hospitals can even be better than Apollo. You know, if Apollo set a standard, you can be better than that. AIMS, for example, has the highest quality of healthcare professionals. They have the world's best doctors. So does JIPMER in Pondicherry. So does PGI Chandigarh. It's the support systems which are a problem. You know, let's not go away from the fact that our doctors are truly world class. And if we as Indians can build fantastic airports, your roads in Indore are beautiful, what we've seen. We're capable of doing it. I think it's just lack of political will, but it can be possible. And let me tell you that if AIMS just cleans up its corridors, sanitation, which is so doable, they're far better than Apollo.
Thank you so much, Dr. Krishnan, for sharing this very motivating and energetic business session. It's time for us to show the gratitude to all the guests on the dais. I now request Mr. Shanes Bhandari, Managing Director of Facet 58, to kindly come up on the stage and present the IMA memento to Dr. Preetha Reddy. Mr. Shanes Bhandari. Please give a big round of applause for Dr. Reddy. Thank you, Mr. Shanes.